Today on AllForBabies, we explain the causes of gas in children and recommend some home remedies to alleviate them. Causes of gas in children. The reason why children suffer from gas is unknown. However, when it accumulates in the digestive tract, it is a result of air ingested during feeding or poor digestion when consuming certain types of food. Several possibilities have been classified. Digestive causes. Firstly, it could be due to digestive immaturity. Intestinal immaturity prevents the proper absorption of lactose, leading to gas, pain, and abdominal distension. Another cause could be food allergies. A small number of gas occurrences are related to food allergies, mainly in children with cow's milk protein intolerance. Additionally, lactose intolerance can be a cause. When lactose is not properly absorbed in the intestines, two compounds, hydrogen and lactic acid, are produced, leading to abdominal distension and gas. Constipation can also be another cause. When children have an immature colon, they may experience problems with gastric emptying and retain stool for longer periods. Crying also introduces air into the stomach, and children do it frequently since it's the way they express their basic needs. Biological causes. When parents are inexperienced, they worry about taking care of their children, especially when feeding them. Many think they are doing it incorrectly, which causes stress. Anxiety can interfere when dealing with simple situations in childcare, increasing crying and colic presence. On the other hand, incorrect feeding techniques can be found. One of the most challenging moments for parents is regarding their children's feeding. It is essential to feed them with the necessary amounts for their age, and slowly to avoid gas. Other reasons. Maternal smoking or exposure to family smoking can be another cause. The presence of gas in children is unknown, but there are factors that influence predisposing its occurrence. Poor eating habits, intolerance to cow's milk proteins, exposure to cigarette compounds. All this, coupled with the fact that some children are hypersensitive at the intestinal level from early stages of their lives. Gas in children can be avoided by applying correct measures regarding feeding, but if they appear, we will give you some useful tips to relieve them. 1. Make them burp. In the case of babies fed with breast milk or a bottle, they should expel the ingested gas, for which it is recommended to burp them by gently tapping on their back. 2. Avoid excessive air intake. It is important to avoid excessive air intake between feedings or meals. If breastfeeding or bottle feeding, the baby should be placed in a semi-sitting position, and breaks should be taken every 10 minutes to release the air. 3. Keep them moving. Keeping them moving, rocking them in the crib, or in your arms from side to side will help release the gas. 4. Help them defecate. With bowel movements, stomach pressure decreases, and any trapped gas in the intestines is released. 5. Don't offer heavy meals. It is essential to avoid offering the child heavy meals or foods that may cause gas, especially candies or those containing artificial sweeteners. Also, do not offer carbonated drinks or sodas. 6. Replace cow's milk. If there is lactose intolerance, the best option is to offer plant-based beverages, such as soy milk, to replace cow's milk. 7. Keep them hydrated. Failing to do so will result in dehydration, causing stool to harden, leading to constipation and gas. 8. Perform massages with natural oils. You can do this by gently pressing with your fingertips on the abdomen, in a circular motion and clockwise. 9. Do exercises. You can help them perform stretching and flexing exercises with both legs against the child's belly to stimulate bowel movements and gas release. 10. Don't offer any medication. Do not use medications without being prescribed by their doctor or pediatrician. Tell us, are you going to implement these home remedies? See you in the next AllForBabies video.